The next tray we're going to go over is the oral surgery tray. This is going to be surgical number 1 for the skills. The first instruments are going to be the mirror and the explorer. The dentist will use those to verify they're working on the right tooth. And then, of course, we're going to do anesthetic. So you'd have the topical anesthetic on the cotton tip applicator, as well as the aspirating syringe. Again, you know the color needle will depend on where you're working. Now, this is where it's a little bit different. Now we want to make sure the patient is numb, and we can do that by using the explorer again after we wait that 10 to 15 minutes and actually poke around on their gum tissue. If they feel it, we know they're not numb enough. If they don't, then we should be good to proceed. So the next step that we're going to do is we're going to use the periosteal elevator. It is big and kind of pointy there. That is going to be used to go in between the teeth and the gums, and basically we're shoving it down between the teeth and the gums, and we're trying to break the PDL, those periodontal ligaments. We want to separate the gum tissue from the tooth. The next instruments are called straight elevators. We have 3 of them we're going to go through. This one is the small straight elevator. And the idea is we want to loosen the tooth. We don't want to just go in and pull it. We want to actually loosen it first. So the elevators are going to help push the tooth out, kind of rock it out of its socket. This one is the medium straight elevator, and it's just the very end. The tip is a little bit bigger. There we go. And then we'll use the large straight elevator. You can see how it's a little bit bigger at the very top. Once the tooth is loose, then we're going to use the forceps. Now, the forceps are different. One's for maxillary and one is for mandibular. If the handle is, there we go, when the handle is down, there you go, when the handle is down, you need to just look at it and see if it's pointing up or not. So, for instance, if we look at it from this view, you can see the one on the right, the very tips are pointing down. That would be for a mandibular injection. And then the one on the left, the tip is pointing up. So that's going to be for a maxillary injection. So you hand the dentist that. That will be what actually removes the tooth. The assistant will then have a gauze, a 2x2 gauze in their hand, and the dentist will place the tooth and the forceps in their hand, and you pull it away. The next step is to make sure that all the debris is gone. Debris would be any blood clots, any bone fragments. So we're going to use what's called a curette. It looks like a spoon excavator, only all surgery instruments are very big and large. So we're going to use the curette. During this time, the assistant would be using the surgical saliva ejector or surgical HVE. They would be using that. That's the surgical HVE. And the surgical saliva ejector is just a little bit smaller than that. And that's so that we don't break any blood clots because we want it to actually clot. After that, when everything is all good, we're going to put gauze folded in half and in half, and the patient's going to bite down on it, and that's to actually have the blood clot. And that way they're going to be good. We will change that at least once before they are done with their appointment. And then we're going to give the patient instructions in writing as well as verbal, where they cannot smoke, drink through a straw, or spit for 24 to 48 hours. The reason being is that it can break that blood clot, and then you could get a dry socket, which is quite painful.